Welcome back, my good people, and in today's video I just want us to talk about something small, and I'm doing this live from Bay County Teaching and Referral Hospital. It is night, so I'm doing my night shift. It's almost midnight, and it's a light night. There are no patients around, so I feel that to kill boredom, we should be able to discuss something small about sinus infection that is called sinusitis. By definition, sinusitis is a medical term for inflammation or swelling of the lining of the sinuses and nose. Sometimes it's called rhinosinusitis, and we say that the sinus are just the hollow areas within the facial bones that are connected to the nasal opening. The sinus are lined with mucous membrane similar to the inside of the nose, and when they are inflamed, they normally cause symptoms that may present like thick discolored discharge from the nose, resulting to running nose, and it may drain down to the back of the throat, and we normally call this postnasal. I'm used to a guy in nasal drainage, and it also can cause blockage or even stuffy nose, that is congested nose, causing difficulty in breathing through your nose. And you should be able once again to know that when there is nasal inflammation, some thick colored discharge from the nose can be experienced more often, and these symptoms are also cardinal to sinusitis. That is, sometimes the discharge can be green, or sometimes it can be yellow discharge from your nose. It can even lead to a blocked nose, and sometimes pain or even tenderness around your cheeks, and even the foreheads. And sometimes it can present in what we call sinus headache. And the typical word sinus is most commonly understood to be paranasal sinuses that are located near the nose, and this normally connect the nasal cavity. There are four main paranasal sinuses, and each corresponds with the respective bone for which takes their name. For example, maxillary sinus, ethmoid sinus, sphenoid sinus, and frontal sinus. All these are affected during this particular inflammation, so we should be able to know those particular parts. Now, when you have those symptoms, normally treatment is even before we go to treatment, causes are majorly virus and bacterial. But bacterial, we normally prescribe antibiotics for this. We can prescribe simple as amoxicillin, clavulanate, or the so-called augmentin. Sometimes we can give doxycycline for those who are having penicillin allergy, or even levofloxacin or moxifloxacin. In children, we can start with the amoxicillin syrup, sometimes erythromycin, or even azithromycin. So guys, sinusitis can be cured because we have acute sinusitis and chronic sinusitis. Sometimes headache can be persistent, and this one we can give you some painkillers to help you to relieve the headache. While using other drugs like mucolytic, we have guaifenesin is a good mucolytic drug, and there are very many mucolytic drugs that can be used to help in this particular infection. Even we have some nasal sprays, or even spraying with saline water, or there are some special sprays that are inserted in the nose, and you spray, and this can cause the mucus to be very, very light, and it can make the mucus to drain away, helping you to relieve the symptoms of nasal blockage. Now, this particular infection can be very, very persistent, majorly in children, particularly those who have allergy. Sometimes it can go up to 4 weeks. You try treating this particular infection, but you are still getting your child still having running nose, stuffy nose, even facial pain, even headache, mucus is still draining from the throat, that's called postnatal drip, and when the child can cough and can even have sore throat and eventually bad breath. So this thing can last even for 2 to 4 weeks or even sometimes 6 weeks. We may also try to rule out other causes of nasal blockage. Even we can look at adenoids, and maybe we refer to ear, nose and throat department, the ENT, to see whether it is due to blockage or just a mere inflammation alone. So mere inflammation, we can just use those medicines that I've told you. Now at home, there are people who normally boil water and insert into their nose. This one normally helps, but we encourage you to do the normal thing, come to the hospital, so that you may be able to get a good physical, clinical examination, and eventually we can go ahead even do x-ray of those sinuses, and even we can go ahead and do a CT scan or MRI just to elicit if there is any blockage caused by a tumor or any blockage caused by adenoids. Remedies are also very, very important. We should be able to note to avoid them. The fruits that are good for sinus infection, here we have the pineapple. Pineapple is very, very important because it contains an enzyme called bromelain. It's found in pineapple, and it has the ability to break the excess mucus and reduce the production of mucus caused by allergies. So what do? Drink pineapple juice, grill the rings for a nice dish, enjoy the fruit alone or salads. It may help you even to relieve allergic reaction. Also, I made a video about ginger a long time ago, and green tea. So drink ginger tea. Ginger tea is very, very important. It helps you to get rehydrated, and when those steams passes through your nasal cavity, it helps to relieve the clogs. And hot ginger tea contains the anti-inflammatory agent, and it is called gingerol. It's very, very important. This compound normally reduces inflammation in your mucous membrane, making this best tea for sinus relief. So it is very, very important. Go to the market and buy that ginger. But food that you should avoid like plague when you have sinusitis. Avoid dairy. If you have had previous episode of sinus infection. Also try to avoid refined sugar, as it is a pro-inflammatory and increases the production of mucus. Other foods to avoid include tomatoes, which contain histamines, chocolate, cheese, gluten, fruits like bananas, which can cause congestion. Though they are important, but in this particular video, try to avoid that, because this may worsen your sinus infection. Salt water is very, very important. That is called saline or even irrigation. This one helps to keep the nasal passage open by washing out thick or dried mucus. It can also help to improve the function of the cilia that help to clear the sinuses. You know, the nose has the cilia that normally propels out foreign bodies. This can help to stop infection from spreading to other sinuses and reduce postnatal drip. Now, this Kenya tuko in maandamano. People are maandamanaring. We are picketing. So, if at all maandamano will go on and you will be tear gassed, kindly know how to deal with this tear gas. This is how you deal with the tear gas. Watch this video here on how to deal with the tear gas, and you will really like this. Kindly, let me see you in the next video. Give me a comment, subscribe, turn on the notification bell for more videos that I will post. Muchas gracias.